The Fox Carolina Health Minute is sponsored by Spartanburg Regional Healthcare System.
Well, October is Breast Cancer Awareness Month, and when it comes to breast cancer, there's one age group we do not hear as much about. It's women under 40.
Yeah, yet more women in that age group are actually being diagnosed. Fox Carolina's Margaret Burnquist has more on what doctors say younger women should be aware of.
When we hear about breast cancer, most people probably think of women over 40. It's what we've heard for years. But Dr. Amy Curtis at the Gibbs Cancer Center and Research Institute says more women under 40 are being diagnosed. She says there are a couple of reasons why. First, awareness is better.
The good news is that there's a lot more awareness about breast cancer and a much greater willingness to share a patient's experience. So we're hearing more about those women because they're more vocal. They're more likely to advocate for themselves. They're more likely to reach out for services. They're more likely to tell their friends and get support from social media.
Second, she says there are some epidemiological reasons.
There are some signals that there may be a small and very small increase, possibly related to environmental factors or delayed childbearing, which is becoming more common in this country.
Dr. Curtis says women under 40 don't get annual mammograms. So she says it's critical for women in that age group to know their bodies and to know which changes are normal and which ones aren't. So if something doesn't seem right, you should report it to your doctor.
The things that we would want women to look out for would be changes in the breast tissue, asymmetry between the breasts, nipple discharge, lumps or masses, arm swelling or a lump under the arm.
Dr. Curtis says the biggest risk factor for breast cancer is family history, particularly a first-degree relative. She says those women should talk with their physician and may want to consider being seen in a high-risk breast clinic. Dr. Curtis says there are also some lifestyle factors that play a role in breast cancer, like drinking alcohol and lack of physical activity. So in addition to being aware of your body, she says living a healthy lifestyle is another way to lower risk.
To eat lots of green vegetables and fresh fruits, to take walks and to do exercise that increases the heart rate. I would advise them to limit their use of alcohol and fatty foods.
And some other notes, Dr. Curtis says scientists have not found any link between breast cancer and cell phones or between breast cancer and deodorants. If you're under age 40 and notice a change in your body, talk to your doctor about making sure to schedule a mammogram.